Good morning, I'm Robert Waters, MD, and this morning I'd like to talk about the cholesterol situation. Now, when one goes to the doctor, very often they do a cholesterol panel, and it consists of cholesterol, HDL cholesterol, the so-called friendly cholesterol, triglyceride fats that are derived primarily from carbohydrates, and LDL. But notice if you look at your lab data that LDL is, quote, calculated. That means it's not measured at all, but rather is arrived at by a formula with the knowns being cholesterol, HDL, and triglyceride. Totally inappropriate and does not give in any way, in my opinion, the actual risk of that patient to heart disease. This is brought home clearly by the Cleveland Heart Lab. Cleveland Heart Lab is a spin-off of the Cleveland Clinic, which is sort of the Mayo Clinic of the East in Ohio. And one of the cardiologists there noted that when people come to the emergency room with a heart attack, at least half of them have normal cholesterols under 200, including people that are already on statin drugs. So he said, gee, we're missing out an awful lot of folks that actually have a serious problem that we're not seeing with the standard panel. So he started looking in the medical literature and found a number of parameters that more exactly identify people at risk. One of these is called C-reactive protein. It's an old-fashioned test, but it's been found that even slight elevations of this number lead to an increased risk of cardiovascular disease. He also noted that an enzyme called myeloperoxidase, which is an enzyme that's upregulated by our body when we have infections, is also very much correlated with risk of heart disease. And this is interesting because there is now increasing proof that cardiovascular disease is at least partly related to chronic infections, either in the gums or elsewhere in the body. In fact, you can find the same bacteria in the coronary artery plaque, the same species, the same genetic types as one sees in the gum bacteria. Another test is microalbumin. This is a measure of how well the membranes that filter our urine are operating. And it's a subtle measure of early endothelial dysfunction. That means the lining of the vessels of the body. And that is where the beginning of the trouble is with high blood pressure and later with plaque formation, which then results in strokes and heart attacks. So these are all very important parameters. In addition, some of the mitochondrial components are measured at Cleveland, and that includes the level of coenzyme Q10, one of the key electron carriers in the production of ATP energy, the energy of life, the universal energy of life. Now, there's a few other parameters that we think very important that often doctors don't measure, and that is the level of serum ferritin. Ferritin is the measure of stored iron. Iron is a very dangerous element, and it must be kept restrained. It must be kept housed in little cages so that it doesn't react and create a rust reaction or free radical bursts, which everyone agrees in the scientific community is the real basis of all disease, from cancer to heart disease to autoimmunity. And finally, the vitamin D level. It is shocking that doctors are not measuring this more commonly. It has been shown to be correlated, that is, the lower it is, the more cancer one sees, the more high blood pressure one sees. It has been, low levels are correlated even with autism and mental diseases, depression certainly. And why is that? Because vitamin D is not a vitamin at all. It is a steroid hormone. It's derived from cholesterol, made in our skin, transferred to our liver where it's further altered and where we measure the product called 25-hydroxy vitamin D, and finally altered once more in the kidneys and in the intracellular compartments to make the active vitamin D hormone 1,25-cholecalciferol. So this vitamin D measurement is vital. I would say, besides knowing your A1C hemoglobin, that is how you're regulating sugar, and knowing your intracellular magnesium, which is the only compartment that really tells magnesium status, and knowing your vitamin D level, you cannot properly do medicine. You must know these parameters, and that is why so many people are still sick despite all the drugs that doctors give. So in this office, We use the Cleveland Heart Lab. We're really the only, believe it or not, medical office in Wisconsin using it, and very few in the Midwest. I don't understand why, but I do understand how important it is, and I'm very thankful to the doctors at Cleveland Clinic for having made this available.